Welcome to this episode of Patient Perspectives in HIV, a CE podcast series. If you are seeking continuing education credit, please review the disclosures and the requirements for successful completion of the activity prior to listening to the podcast. A link is found in the show notes that can direct you to this information. After listening to the podcast, please go to practicepointcme.com to complete the post-test and evaluation to receive continuing education credit. Joining us in this episode is Dr. Babafemi Taiwo and his patient, an older man with long-term HIV infection, multi-resistant virus, and multiple comorbidities. Thank you for your attention. The podcast will now begin.
So we're going to go ahead and start this discussion with one of my long-term patients who, of course, is living with HIV and has gone through quite a lot with this condition. But still, I consider him a hero and someone who motivates not just other patients, but also me as an individual, apart from my role as a practitioner. I think listening to him, we will understand a lot of things from his perspective. And I'd like to start by just going way back to the time when HIV was diagnosed. So tell us about your HIV status some 20 years ago.
I was more like going to my doctor for a regular physical checkup, and he drew blood and did tests on my blood and all that, and then found out. He gave me the news that I was HIV positive. And I was kind of very depressed about it. And, I went through that whole ordeal about killing myself. But I thought that's not the way to think. I gotta keep going.
After diagnosis, you had some contact with the healthcare system. Sounds like you were well received and you started treatment. But the treatment that you got was the old AZT treatment, and you used the word barrage of medicines. When you said barrage, are you talking about just the number of pills that you were prescribed?
It was different drugs at certain times. I guess at that time they were looking more at the CD4 count, not the viral load.
Right.
But viral load was off the charts at the time, and the CD4 count was in the triple digits. So the drugs that Advocate was giving me just weren't working, and the combinations weren't working. And I came down with pneumonia at one point because it was a bad pneumonia. It kept me in the hospital for a week. But I got through it. And,
So this was a really difficult time. You were getting a barrage of medications. What about side effects? You were getting all these medications. How was your body responding to it?
I wasn't sick or anything. I didn't get sick or anything as to, physically vomiting or getting nauseous or anything like this. I took the pills quite well. And everything was, I thought was working, but evidently when they took the blood tests, it just wasn't working.
And so from what you've said so far, you had this initial barrage of medicines that really weren't working. You had PCP, a signature infection, confirming that the drugs weren't working. And now you had to go find help somewhere else. And that's how you went through Medicare and you landed at Northwestern. So can you tell us about how your treatment changed once you really had another chance at coming up with at having new treatment options?
The doctors gave me this combination and it was starting to work. So I stayed with Northwestern, and I followed your instructions to the letter. I didn't sway left or right. So I took these pills twice a day, and then other pills started coming in, like propranolol for
Right, and you make it sound easy, but in fact, you actually do have, as you alluded to, some resistance, not just to AZT, but to quite a number of other drugs, which is why you're taking what might be considered even today a fairly complex regimen. How do you cope with all of that?
I notice no side effects. I take 13 pills twice a day, and one that's done 3 times a day for bone strength.
Important point is that you're on a complex regimen, but you're well suppressed. Your CD4 count is high, but you still have to take about 13 pills twice a day. In the medical field, we have a term for that. It's called polypharmacy. And this is something that we're seeing more and more as people get older, because not only do they have to take HIV medications, but they have to take medications for other conditions. Some people have diabetes, some have high blood pressure, high cholesterol, bone health, vitamins, a number of things come into play, and patients end up on multiple medications. And sounds like how are you coping with taking 13 pills twice a day? Is it built into your system now? You just do it at work, or does it bother you sometimes? How are you handling this?
I feel like I have to take them, especially diabetes pills. I have to shoot myself with insulin every morning. And that's one thing I don't like is using needles.
This is one of the reasons why it's important for the HIV field to keep looking for better treatments, simpler treatments, things that people can use by self-injection or by long-acting therapy. So a lot of work still left to be done in the field. Let me ask you to do one thing, which is to list for us some of the other conditions that you're struggling with.
I did lose a kidney due to cancer. I had bladder cancer for the longest time. I had to go through a number of cystoscopies to alleviate that. I don't think I have any problems really with my liver, although it's fatty liver. That again is caused by a lot of the medication that I'm on. I've had portal hypertension from the liver.
How about memory? How about your strength?
My strength isn't exactly that great, and my memory is not the greatest. I'm not complaining.
Right.
I more or less stick to myself and take care of things that I have to take care of.
Right. And these are some of the things that we hear commonly from persons living with HIV, which is that over time, they can actually notice some changes in their memory. It's not rare at all. The other thing that you described as the weakness part, actually the field now is coming to recognize it more and more and use a term frailty to sort of describe that syndrome or that clinical picture.
Every day is a new episode, Right now, dental, you got to remember, dental is a big thing too, because some of these drugs eat away at the enamel of your teeth. So right now I'm losing my teeth, and my dentist is going to try to make me dentures. I just want to start this chemo that I'm going to be going through.
What are you going to be getting chemo for?
That's kind of embarrassing for me to say. I had developed not colon cancer, but it's called it's a rectal type of cancer, and I don't know how the heck it happened, but it happened. And so I've got to go in for chemo treatment because that's where the cancer is.
Right. And indeed, cancer in the anal rectal area, the anus and the rectum, is another one of the things that in many cases are linked to another virus that actually travels with HIV called HPV, the human papilloma virus, that way back then we didn't have a vaccine to prevent it, but now we have vaccines that people are getting. Every teenager now actually gets vaccinated against HPV, which we know is in most cases associated with this form of cancer. But as you've done over the years, I'm confident that you will go through this and come out stronger at the other end. Looking back, what are some of the key learning experiences in your journey with HIV, the other conditions associated with HIV and HIV treatment? Imagine you are talking to somebody who's just been diagnosed with HIV, or somebody who's been living with HIV and is sort of struggling right now. What would you tell them?
Well, I would say that it's going to be a rocky road. You're going to be up, you're going to be down. You're going to have times of depression. You're going to have times of great joy and everything. It's just that you can't let the bad overwhelm the good. And that's how I look at it, as everything I've gone through is a learning experience for me. I've learned so much from that bladder cancer. Now I'm learning more of what happens when how can I say this? When men get together and go through a sexual bond. You know, it's something, it's something they have to consider.
Right. So you touched on a lot of important things. And I think one more thing that might be helpful, particularly to somebody who's just diagnosed, is that they really would, in most likelihood, not have to go through what you went through in terms of going through the barrage of medications that you went through in an effort to find one that might work, or a combination that would work. Fortunately, now the field has moved so far ahead that the newly diagnosed person can really find, in most cases, a single tablet that they can take. Very different from your story, but you're still doing well.
There's so many drugs that they're advertising on TV that you take it before sex, or you take it after sex, and and then you're all clear for anything. So
right.
Those kind of advertising, I kind of question.
So I guess your point is that even though we have treatments now that can prevent transmission of HIV, we have to be careful in how we communicate that message, so that we don't let people go around thinking that, HIV is not something that I need to worry about. But it's still true that those treatments are effective, and we should encourage it when we can. Any final thing you'd like to say before we wrap up?
No, it's about it. Thank you very much for the time, Doctor. I really appreciate it.
Okay. Thank you so much. And that will end our podcast for today.
Thank you for listening to this episode of Patient Perspectives in HIV. Please go to the activity page on practicepointcme.com to complete the post-test and evaluation to receive continuing education credit.